Welcome to this really important series on anxiety and depression, something that both of us have experienced in periods of our life. And it's something that whether we experience it personally, we're definitely going to have friends and family that are going to go through anxiety and depression. So this is such an important topic and one we think you'll get a lot out of, whether it's for you personally or supporting those that you love. So, yeah.
Yes, so today, Ben, we're going to chat about anxiety and depression because the reality is it's pretty much going to affect all of us in our lifetime, whether that be that we experience it ourselves or we know someone that experiences, right? So I'm pretty sure we can both probably think of many people in our world that have anxiety or depression or experienced it in parts of their life, or for ourselves as well, right?
Totally.
Yeah, so I think it's an important one to chat about because it does affect so many people, and we're going to show you quite how many people that affects. So as you can see, in Australia alone, according to Beyond Blue, around 1 million people in Australia live with depression and around 2 million live with anxiety. So that with depression, they estimate about 1 in 5 women and 1 in 8 men are likely to have depression at some point in their lifetime. And 1 in 3 women and 1 in 5 men are likely to have some sort of anxiety in their lifetime. So it's more women than men, but what you'll note as well down the bottom is that 6 Australians die by suicide every day, but 5 out of those 6 are men. So whilst women tend to have more anxiety, unfortunately, you know, with suicide, men, it's more common amongst men. So just looking at those stats, Ben, like that's probably an underestimate, to be honest.
Yeah, I was just thinking about that. I was talking to one of the guys I knew 15 years ago, and we just reconnected via Instagram, and I found out that one of the guys he was really close to that I knew quite well committed suicide last year. And if I think about in my lifetime the people I know have been close to committing suicide, it's actually a few. So yeah, all guys. That in my experience has been all guys.
Well, it's unfortunately, yeah, like we saw, it's a higher rate amongst men. But you know, I think what some of those stats go to show is how many people are affected by anxiety and depression at some stage in their life. And the World Health Organization estimates, I think it's over 260 million people worldwide have depression. And it's actually one of the leading causes of disability and burden of disease. You know, and in Australia, I think it goes cardiovascular disease and cancer in terms of, you know, burden of disease, then mental health, above other physical disorders. So it's a huge, huge topic. It's a huge concern. Too much to go through in one episode. So we're going to pop some links that you can find out a little bit more about for yourself. But we will sort of touch upon briefly some symptoms of depression and anxiety. And what's important to know too, Ben, is that there are different types of depression and anxiety, and we're not going to touch on all of those. So there's things like bipolar disorder. That's a form of depression, or there's postnatal depression, post-traumatic stress disorder, social anxiety disorder, all forms of anxiety, panic disorder, but we're going to sort of focus on the more general, I guess, more common depression and anxiety issues. So we're going to take a look at some of the symptoms. So as you can see, there's a little bit of an overlap between symptoms of depression and anxiety, which is why we're talking about these together, because they do often co-occur. So not always, but people with depression or anxiety often have both. So some symptoms of depression can include sadness, irritability, feeling worthless, you know, losing interest in normal activities, feeling tired, and that can also go over into excessive worrying, agitation, restlessness, which are also symptoms of anxiety. And then with anxiety, you get some more of those physical symptoms, I guess, of feeling sort of trembling, feeling nervous, having increased breathing rate, heart rate, sweating, that kind of stuff. But as you can see, they overlap. And this is not an exhaustive list of symptoms either. So I think we all probably experience some of that at some point in our life, right?
Totally.
So one important thing to note is that if you do have some of those symptoms, does not automatically mean that you have an anxiety disorder or that you have depression. So, for example, with depression, you need to be experiencing some of those symptoms for a period of at least 2 weeks or more.
Okay.
To actually be diagnosed with depression.
Yeah, because I've had all of those experiences at one stage or another.
Yeah. And depression's different to just normal mood swings.
Yeah, okay.
So, you know, we might sometimes think that, oh, you're depressed, just get out of bed.
Yep.
It's not like that. It's different to our ups and downs and our sadness and our mood swings. It is so much more consuming than that. Yeah. And you can't just help it. Yeah. You can't just get out of bed. So it's important to recognise that as well. But we will all sort of have periods where we're feeling a little bit anxious about something. Mm-hmm. So I've got a little image as well just to show you some healthy anxiety and then when it becomes a problem. So we've all experienced a bit of anxiety or feeling nervous or, you know, getting worried about something, and that can happen. And normally it's okay if it just lasts a short time. If it happens when you're under stress, you know, it doesn't affect your daily life. It doesn't affect, you know, it doesn't really impact you too much. Mm-hmm. Becomes a problem, as you can see in the other column, when it lasts for months or years. It's not always linked to a stressful situation, so there might not be a reason for you to feel anxious, but you do anyway. It stops you from doing things. So some people, if it's particularly social anxiety, they might not go out, they might not leave the house, they might not want to get into a car. Yeah. And just really excessive worry about things that aren't likely to cause you problems.
It's an interesting one because when I look at the normal anxiety and the problem anxiety, I'm aware of like a low level normal anxiety throughout my life, and then I've had periods where I've had that problem anxiety. So when I was 29, I went through a period of burnout, or and it did last for a couple of months, and it was much more debilitating than the low level anxiety that I carry around. So I've experienced a period of that, and I've experienced times where it's come back for like a week or two. Yeah.
And we can have episodes of depression or anxiety without it being an ongoing depressive or anxiety disorder. Yeah. You know, in year 12, for example, I was diagnosed with mild depression, and at that time, you know, I did go on to antidepressants for a period of time, but I haven't had, I guess, any struggles with that since. I'm not on any antidepressants. I haven't been diagnosed with it again. I've certainly been through situations in my life where there's been that situational depression that has not been ongoing, but it's been because of something. So that can happen after someone has died, or the marriage breakdown, or loss of a job. So we can have episodes of depression that you can recover from. Yeah. The ongoing depression is usually probably where people need that ongoing treatment and strategies, or maybe medication, whatever it might be. So I think that's important to kind of distinguish between having moments of anxiety and feeling depressed or having situational depression, and then when it becomes an ongoing thing. And you know, it's only something that if you are worried about it, then absolutely see a doctor or a counsellor, psychologist, so that they can actually properly talk you through it and diagnose if that's what is needed. So,
I've even seen my counsellor when I wasn't in that real problem anxiety, but I could see myself heading that way. And so I try and get it before it gets too bad, I guess. I actually try to work with it earlier.
Oh, there's so many strategies for managing both. And it's something that we're going to unpack in the next couple of episodes. Is some really practical strategies around dealing with depression and dealing with anxiety. So we're going to have a look at those, and also where and how to get help, and finally how to support those around you that might have anxiety or depression.